our very first program is training and capacity building of traditional birth attendants. And this is something that we started in 2017. So not just traditional birth attendants, but also community health volunteers, so TBAs and CHVs. Why we are doing this is because the community in East Pokot, they're not able to access primary health care, especially for women and children, which is our primary focus. So because we have this resource in the community, we are building their capacity to be able to provide basic health care, or rather maternal and child health care services within the community. What we do is that we train them on how to use something that we call birth kits. So the situation, or rather the environment that the traditional birth attendants and the community health volunteers deliver babies within the community is unhygienic. So what we have in the kit is that we have a nice sheet that you can spread where the mother can be placed when they're delivering. We have other basic equipments like something like a surgical blade that they are able to use, rather than use things like stones or anything else, or machete, or rather panga, that would eventually create infections either to the mother or the baby.
Sisi kama community volunteers tukishaona huyo mama mjamzito, kwanza sisi tuna identify mahali yako na tunafuatilia mpaka tuhakikishe kwamba amezaa vizuri.
So the other thing that we are actually in the process of doing is building a maternity unit and a resource center. So the maternity unit is going to provide integrated sexual and reproductive health services to the community. So this is a need that has been very dire in the community. And in this center, in this maternity, we are going to be fully equipped, and we are going to be able to also have medicine and some of the things that the community really is not able to access, or they would have to travel more than 50 kilometers just to access very basic services.
The Mama Resource Center it's in a strategical place, so we are able to serve other villages that are around Orus. And our vision as Mama, we are looking forward to reduce the mortality rate in this area. We are looking forward to help people access health services and education. We are looking forward to help our community sustain themselves through the IGs that we are implementing. And we are really looking forward to help the Orus community to have everything that they need for a good health system.
There are so many other factors that contribute to a positive health outcome in the community, and one of them is nutrition. So we have cases of malnutrition among kids, and there's cases of drought and famine. So this is a community that is not able to access food. So one of the programs that we want to introduce once the center is open is that we want to introduce something called kitchen gardens. So training and capacity building the women within the community on how they can make use of the little water that they get to just create a very a kitchen garden where they can basically just get vegetables to supplement their food. Things like lack of a livelihood comes in. Women are the ones who provide for the family. So one program that we are introducing is the beekeeping business, where we are going to employ women to help us with the business in the entire supply chain. And in this way, they are able to get an income to feed their families. And for Mama, we will be able to sustain our programs and our resource center as well as the clinic.
Hii sehemu hakuna mtu amesoma. Hakuna masomo, hakuna watu wamesoma kwa shule. Ukiambia mambo na health services, waelewi. Lakini through Mama Group tumeweza kuinteract na wazee ya sehemu hii, kueleza umuhimu wa kupeleka, yani kwenda kuzalisha hospitali, umuhimu wa kupeleka mama aende clinic, umuhimu wa mtoto apelekwe clinic, umuhimu wa hospitali haswa wakati unaenda kuzalia pale.
We are looking forward to partner with other organizations in areas such as water. Water has been such a huge problem in East Pokot and has contributed largely to poor health outcomes within the community. So providing clean water is one of our priorities. And the other area that we are looking forward to collaborating is in areas such as education. Education will transform the community, will transform the different generations. So, and also you'd find that parents would take children, or rather ask children to go to school when they know that there's at least a meal provided in the school.
Watu wa sehemu hii wamekuwa na tumaini kubwa sana katika ya mama group. Walipenda wakati tulimweleza kwamba tutabase mama group watabase conception hadi mtoto ifike mwaka 5. Watu wa sehemu hii walipenda sana, na alafu wakasema hii mama group itatusaidia na ita-reduce death rate katika hii sehemu.
We envision a community that is empowered to be self-sustaining, self-reliant, with positive health outcomes. A community where women and children are healthy and families are thriving. We invite you to join this journey. To partner with us, visit our website for more details, or visit our social media pages to see the impact of our work.